Our health correspondent Nicola Hill in London. Fantastic to have you on the programme. Does recovery from COVID-19 not mean immunity, Nicola?
Well, this obviously is what we were all hoping, that if you'd had it once, you then were immune from having it a second time. But obviously, this research that's come out from South Korea is questioning that. Now, there are theories, as you said, whether the virus itself was lying dormant in people, particularly if they had certain medical conditions or they had a weakened immune system, or whether or not these people have come against the infection a second time. So I've been speaking to Professor Martin Bachmann, who's a very eminent expert in immunity and immunologist at the University of Bern in Switzerland. And he says this is what many scientists are trying to discover at the moment, whether if you've had the infection, you have a natural immunity against a second infection. Now, he says one of the theories being discussed is if you have moderate or severe disease, perhaps you're more likely to then have this immunity against a second infection. But if you have a minor case of COVID-19, you might not have that same immunity the second time round. But he says, obviously, this is just a theory. But we want to know about this immunity, because then that obviously would help ease the lockdown. Once we know that enough people have had the disease, it's safe for them to mix around with people.
Absolutely. And remind us what tests are available and what exactly they do.
So there's two types of tests. Now, there's the swab test, which we've seen the pictures of. This is the test of the mouth or the nose. It's something called a PCR test. And this is to determine whether somebody actually has the infection at the moment. The second test, the serological test, is the one that's looking for antibodies to see if somebody's had the infection, fought it off, their body has created antibodies against the virus, and that hopefully they're immune to it a second time round. So these are the two tests that are available at the moment.
And it's very concerning because we hear that some of the tests, the test kits, have problems. How reliable are they? And this is very, very worrying.
It is, isn't it? Particularly because there's so many tests. Now, I was looking at the Centre for Security website in America, and I was just counting. At the moment, there's 12 tests that have been approved. There's a further 26 that are being used for research purposes, and another 11 undergoing approval at the moment. I mean, there's so many different types of tests. And these can apparently give results in as quickly as 10 minutes or 5 hours. Now, Professor Bachmann said one of the problems that we've got is discovering the sensitivity of these tests. Now, he was explaining a lot of the science to me this morning. I won't go into too much detail because it's very, very scientific. But what he told me is that basically some of the tests are looking at a certain part of the virus. It's something called a nucleocapsid. Now, if the body creates an antibody against that, it doesn't automatically give protection against the disease. What they need instead is to create an antibody against that spike protein, that little spike that we see when we look at the virus. And so it's important to have tests that can tell whether the body has created an immune response against that spike protein, and therefore they've got protection, or whether it's against this other part of the virus, which doesn't give the same protection. And he said this is one of the issues at the moment that they're having to look into. Many of the tests available aren't sensitive enough to differentiate between those two parts of the virus.
Nicola, it really is fascinating and concerning. Nicola Hill in London, thank you very much indeed. Pleasure.